So much of this sounds like ME/CFS, right? Which I'm sure you know about.
Yes, of course. Yes.
Is it the same? Is it different or similar?
I mean, it's some symptoms are similar, but I wouldn't say that it's the same. But ME/CSF can also occur after a viral infection. So maybe the thing is that we have a unique situation here because we have so many that had COVID-19 at the same time, and then they develop long COVID, whereas ME/CSF is much more difficult because they developed, they had maybe a viral infection, but it's various kinds, and often these patients are sort of going around in healthcare and are not taken seriously and misunderstood. So I think maybe it will help us to understand ME/CSF, but I can see differences in the symptomatology, and also, I mean, COVID-19, there's a lot more problems in the lungs in our patients. Dyspnea, and also we can, see asthma seems to be something that you can develop due to in your post-COVID problems, but also that asthma could be a risk factor for actually developing post-COVID.
So I know that many of the ME/CFS patients feel that their onset happened after a viral infection, but it's not any specific virus. It's just
it's probably different viruses, but I think here we have sort of a very, very distinct timeline, and it makes it much easier, I would say.
Yeah, as you said, you have so many people infected at once.
Yes.
And now you have this onset. You can correlate with that and makes it a lot easier.
Yes, and you also have a follow-up that is more or less the same. So, I mean,
Well, as you know, the ME/CFS has been known for quite a few years, and the patients feel they are ignored, right?
Yes, I know, and I have also taken care of ME/CSF because at that time when I was a young doctor.
You're still young.
No, not very young, but anyway, I'm more experienced now. But we had an outpatient clinic for ME/CSF because the objective of that clinic, and that was also a research objective, was to see if there were residual viruses that could explain the condition. But the findings did not support that. So, but I mean, what is special about COVID-19, I would say, in the acute phase is what we saw, and I've worked for a long time as an infectious disease doctor, that it was so multi-organic. It sort of attacked all organs. And that is quite unusual, I would say. So first, the obvious thing were the lungs, but then it was, the kidneys, the brain, the thromboembolism. We were quite struck by this multi-organic involvement, and therefore it was not unreasonable to think that this would be a problem in the long term, that we would actually have multi-organic involvement. And unfortunately, we were right in that assumption.
Many of the ME/CFS patients are very happy about long COVID because now there is attention to a different post-acute viral disease, right?
Yes, and which is also, I mean, we know that in influenza you can have, post-influenza syndrome. We also see that in, for example, tick-borne encephalitis, Lyme's disease. I mean, we know that there are a lot of viruses, and also that some actually we don't clear these viruses. They can be there and pop up when
probably every viral infection has a consequence, right?
Yes.
And we just don't see it because the numbers are small or the infections are asynchronous.
Yes,
right?
But I think COVID-19 has shed a light over ME/CSF, but also of other post-infectious syndromes that we have not it's not been ignored, but as you say, the numbers have been small.
Post-polio, for example.
Post-polio, that was something. When I started, my training as an infectious disease doctor, there were wards that they were abandoned, but that had been for all these iron lungs, the young patients that were in the iron lungs.
Yeah. During the COVID that worst days, some physicians said they would like to have iron lungs because it's gentler than intubation.
Yes.
Right?
Yeah.
Because intubation can be very problematic,
yes,
as you
of
know.
course.
Yeah. But the iron lung is gentle, but no one has iron lungs anymore.
No.
Except museums. I've seen them in museums.
Yeah.
I heard that many SARS-1 patients had long consequences as well. They're not as well known. Yeah.
No, but this was, that virus was not a very clever virus because it killed its host in too high percentages.
Yeah,
SARS-CoV-2 is much more clever.
We only had 8,000 SARS cases globally.
800 actually, 900 in total. And then we have MERS, of course. But there were a number of studies that were sort of reanalyzed and published in 2020 regarding long-term sequelae of SARS-CoV-1. Follow-ups of up to 15 years, which showed quite severe sequelae.
People have been mentioning those as well.
Yes.
Yeah. It's interesting. Is there anything in common?
Yes, pulmonary sequelae also is a more multi-symptomatic picture, multi-organic picture, which was good to know when we designed our follow-up study and clinic.
So what about MERS? Are there long-term so some people recover from MERS, right?
But yes, and that has not been studied as well, but it has been described also with MERS. But also with MERS, very few cases, so it's difficult to draw any firm conclusions.
And then my last question is, we have 4 endemic common cold coronaviruses.
Yes.
Is there any, and most of these are mild, right? But
yes.
It doesn't, for long COVID, it doesn't matter if your initial infection is mild, you can still get long COVID. So do we know anything about post-acute sequelae of these common cold coronas?
No, I don't think. In immunocompetence, I
never saw that.
No, and I think we've known these viruses for so long.
Yes.
Yes, this SARS-CoV-2, it was a new virus. I had COVID-19 December 2020, and I remember that I thought this is something new. I didn't recognize all these symptoms that I had, and I also lost my smell.
Yeah.
But it came back, fortunately.
But it could be that some cases of ME/CFS occur after a common cold coronavirus infection. We don't know.
We don't know.
Hard to make the association.
Yes. We don't know.
Okay.
It has not been studied well enough,